let's say you're somebody listening at home and you just found out, that you're pregnant and have a pregnancy. How do you see, what are your top issues there to look at?
Yeah, I think, so number one, let me just kind of go a little geeky and go a little bit into the science, because I think people don't realize this. There are so many things that you can do wrong in pregnancy that actually will impact your offspring later on in life. Specifically from a cognitive approach. So, it's interesting. I am a senior fellow for a place called the Meadows, which is basically an addiction treatment center in Arizona. And they do behavioral health and everything like that. And so I have done so much research for them, just looking at, prenatal nutrition. So you're pregnant. What does your nutrition look like? Is it super high fat? Is it really full of junk food? Is it not nutrient based? And we see, now some of the studies are in animals, but we do see that long term that can really negatively affect your offspring's mental health. So we see some of these kids that are more prone to depression, to anxiety, because the maternal diet was really not a good one. Right. So, and there's changes in gut health and things like that. So kind of, I think that's the first thing to think of. Don't think it doesn't matter what I do today in terms of my diet, my kid's going to be fine because I'll feed him okay. Right. That's really not accurate. Where we see the greatest associations are incredibly high fat diets. So no pregnant woman would do keto to begin with, but if your diet is really high in saturated fats, naturally occurring trans fats, we do know that could lead to kind of worsening cognitive development in your offspring. So there are things you can I hate to say it, but people talk all the time, I don't want to screw up my kid. I want him to be a normal adult. You can screw up your kid starting when your kid's in utero, right? That can happen there. So, so there's that component. And then I think just the basics, right? I mean, I always tell my patients when they're saying I really want to get pregnant, or I want to start thinking about pregnancy, as much as it's boring to hear about, you always want to focus on that folate acid, right? So you want to make sure you're getting enough folate. I think the genetic conversation is really important there because of the MTHFR mutation. 48% of the population has that. So if you're female with an MTHFR mutation, you're going to have to take a methylated folate. The folate in your prenatal vitamin might not cut it, right? So, things like that I think are really important. We know the obvious. You don't smoke, you don't drink, that kind of thing. But just really a Mediterranean diet approach, and making sure you're getting those omega-3s, DHA, EPA. Again, not to say if you're vegan that the walnuts won't be as good, but alpha linoleic acid, which is what comes in plants, has to be converted to the marine-based. And if you look at all the benefits we see in the marine-based and pregnancy nutrition, they tend to trump the plant-based options, right? So even if you're I still want to stay vegetarian, I would encourage my patients, okay, well, at least take an EPA DHA multivitamin, right? At least get the marine base of the DHA for brain developments, right? There's where that cognitive comes into. Iron is really important. A lot of females don't think about that, but your blood volume increases when you're pregnant. So you got to make sure, am I getting enough iron? And we, of course, we have genetics to show whether you'll have an iron overload or you're more prone to iron deficiency. But if there's ever a time when a woman could become anemic, it's during pregnancy. Right? You got that huge, blood volume and it's getting all sucked up by the baby. And, I always say things like choline and getting away from the Western diet, all of that is really important. But we have to get away some of the old notions that you're eating for two and that kind of thing, right? Those are you're not eating for two, you're eating for one. And that one is got to have the best nutrition possible to pass on to what is growing inside you. So in a lot of ways, the answer is obvious, go a whole foods diet, a clean diet. If you want to be a freak about organics and things like that, now's the time to do it, right? Get everything out of your body that might be a toxin, right? Because I always tell people, you got to look at what you're doing in a certain amount of time. You just need to be good for this child for 9 months. Right?
Yeah.
If you're not, the susceptibility of preterm labor and of low birth weight goes up, right? And once you have that, that's when you have developmental problems, things like that. All of those things can follow.